everybody. I'm Christy Chambers. I am a survivor. I'm a stage 4B cervical cancer survivor who just got my NED of this year in May. Um, and I welcome you for being here today. We are so excited to have lined up so many wonderful programs, speakers, and just general information that we are spreading out across social media and other places here during Cervical Cancer Awareness Month. Thanks so much for tuning in, and do let us know if you end up watching on the replay. Please comment there as well and let us know that you are watching. I'm here today on our coffee break with Dr. Rebecca Perkins, and I hope, Dr. Perkins, you would go ahead and introduce yourself and tell us what you do for your career.
Sure. I'm a gynecologist. I work at Boston Medical Center and the Boston University Chobani and Avedisian School of Medicine. I'm a professor of obstetrics and gynecology there. And I've been in practice for about 18 years. And during pretty much all of that time, I've dedicated my research career to cervical cancer prevention. So I've done a lot of work with HPV vaccination and then also with screening and prevention. I currently serve as one of the tri-chairs of the National HPV Vaccination Roundtable, as well as one of the tri-chairs of the national consensus process to update guidelines for management of abnormal PAP and HPV tests.
Oh, wonderful. Well, thank you so much for being here. Little side note, I love the HPV Roundtable for information and all of their infographics. It's tremendous. Love that resource so much. Medical professionals have such busy schedules. So thank you for taking a coffee break with us so we can have a conversation about the work that you're doing in the cervical cancer space. Would you mind sharing an overview of what HPV is and how it's connected to cervical cancer?
Sure. So HPV is a virus. It is a virus that lives on the skin, and there are many different types of HPV. And HPV stands for human papillomavirus. So there are actually different papillomaviruses for like mice and horses and other mammals, but ours is the one that bothers us is the human papillomavirus. And there's many different kinds, most of which don't cause cancer, but some of which do. And HPV can cause 6 different types of cancer in people. It can cause cancer of the oropharynx, which is the tongue, base of tongue and tonsils. It can cause, which is the most common cancer in men and overall now. It can cause cervical cancer in women, and people with a cervix, which is the most common HPV-related cancer worldwide, but not in the United States because of screening and treatment. And so just side note, it's Cervical Cancer Awareness Month. Everyone, please get screened for cervical cancer. And if you have an abnormal result, don't be like my patient this morning who did not come in for her follow-up, but please do attend your follow-up appointments. We will be calling her and getting her in.
I agree. I have to freely admit that I knew about HPV. I sort of knew about cervical cancer, but because at the time that the HPV vaccine, when it was first released, I was not sort of the demographic, if you will. I was older. It wasn't really aimed towards me. So to be fair, I sort of was like, well, okay, cool. Didn't really think about it. Was off the radar. And it really wasn't until, unfortunately, I was diagnosed with cervical cancer that I obviously started paying more attention to HPV, rather, a lot, because I was like, okay, wait a minute. And because I have a teenage son, he just got his HPV vaccine this year. So that's a side note. But yeah, I unfortunately learned about it the wrong way around by not realizing that I had it, and then that it eventually developed into cervical cancer for me. So mentioning abnormal cells, is it true that abnormal cells are not always cancer?
That is true. So what happens is the HPV, and we're sort of focusing now right on the cervix, which is really the only HPV cancer for which we have a screening test for everyone, which is usually the HPV test, some plus or minus the PAP test. And the HPV enters the cell and then causes the cell to sort of first become a little HPV virus factory. So it just makes lots of HPV. But then over time, sometimes the HPV can actually just take over the cell machinery. And so that cell just starts to replicate. Instead of producing HPV, it just starts to replicate itself. And the normal processes by which all of our cells sort of age and die gets shut off. And so that's when it can become a precancer, and if not found and treated, can become an invasive cancer.
Got you.
So,
And how are they typically treated?
so if someone, I'm sorry, I'm going to just close that tab. If someone has a positive HPV test or abnormal pap test, they come in and get a procedure called a colposcopy, which is where we apply a vinegar solution to clean the cervix, and then we look with a magnifying glass and bright lights. So it's actually not very high tech. But because those cells are, they're sort of multiplying abnormally, we can actually usually see them as little sort of white patches on the cervix. And then we'll usually take a little biopsy of those cells to see what's happening. And if it's just a little bit abnormal, we call that sort of a low grade or what's called a CIN level 1. And those often your body's own immune system recognizes that the virus is there, and it sort of bonks it on the head, knocks it out, and controls it. And most people, in that situation, the HPV is under control by the immune system, and we don't need to do anything.
Mhm.
If it has advanced to be what we call a high-grade precancer or a CIN level 2 or level 3, that's something that we usually do treat. And in the United States, that treatment is usually what we call an excisional treatment or a loop electrical excision procedure or LEAP procedure, which usually we can do in the office with local anesthesia, and we just remove where the abnormal cells are. And then 90% of the time, you're fine. And it prevents cancer because the abnormal cells are still just on the outside and they haven't invaded.
And you've gotten them all through that procedure,
Yep.
like collected them all. Gotcha.
Yep.
And so are there like symptoms of abnormal cell changes or cervical cancer? Like, do you, would you have an idea, or would you know that that's what's occurring, and is it preventable?
So yes, it is preventable, but until someone actually would have a cancer, they usually don't have any symptoms at all. So that's why it's so important for people to be screened. And actually screening, the definition of screening is doing the test in an asymptomatic person, so someone who feels completely fine.
Mhm.
Because what we want to do is catch those abnormal cells when there's only a few of them and it's really tiny and easy to remove. So that's not something that somebody would know that they had.
I think that's why we sometimes have referred to it in our learning sessions as surveillance, right? So that we're sort of trying to keep an eye on it and keep on top of it, but
Exactly.
keep a regular eye on it so that we are aware when there is a change. Because if we don't
Exactly.
have a baseline, we're not, nothing to compare it to. I think we just don't even know that there has been a change.
Right. Yeah. And
Are
everybody with a cervix needs to have it checked at least every 5 years. And if it's been abnormal, more often than that.
Gotcha. And so about screening though, can you give us more of an overview of that screening and how those guidelines work?
Yes. So there are a few different sets of guidelines. I'm going to focus on the American Cancer Society guidelines because the U.S. Preventive Services Task Force guidelines, which are the ones that most people follow, are under review. So those may be changing soon. But what everybody agrees, actually, I'll focus on the guidelines that everybody agrees on. Between the ages of 21 and 29, people don't agree because vaccination is making women or people with a cervix under the age of 30 much less likely to get cervical cancer. Yay! So that means there's disagreement on what you should screen with and how often you should screen. So over 25, you should definitely screen with something. 21 to 25, maybe you should screen with something, but we're going to focus on 30 and over, where everybody should get at least an HPV test every 5 years. If the HPV test is positive, then then the lab should be performing a pap test as well, so you get both of those results. Sometimes people get co-testing, which is where they get the pap test and the HPV test at the same time. At this point, I don't think anyone over the age of 30 should be getting a pap test alone, because the HPV test picks up so much more abnormalities. And every 5 years is enough for someone who's always had normal results. But if you've had abnormal results, you may need to screen every 3 years, or if it's very recently been abnormal, even every year.
Okay. Oh, and gosh, I'm just trying to think like if there was other questions specifically about that I had. I think in what you do and in your career and experience, do you deal a lot with reluctance to get screened?
I think I deal with less reluctance to get screened because usually patients are referred to me. So I'm not seeing, because we have in the office where I work, there's primary care doctors, and then there's also nurse practitioners who do a lot of the routine healthcare. So by the time someone gets me, it's either they've had an abnormal screen already, or they had a very difficult time screening, so they're coming to me for like a specialist to do their screening. So myself in my own practice, not that much, but certainly it's something that we hear about. And in the studies that looked at people who had cervical cancer, the most common reason was, I didn't think I was going to get cervical cancer.
Right.
So
Right.
people feel fine, they feel healthy, they don't think they're at risk, and then they don't get screened. And then because HPV is so sneaky, and everybody has it at some point or another, it's really important to get screened, because otherwise you just never know which person is going to develop cervical cancer.
Right. And I think, and that's one of the myths I think we're trying to dispel too, is
Yeah.
that everyone says, but I feel fine. Why do I need to screen? I mean, there's nothing wrong. Well, how do you know,
Right.
without that actual screening?
Yeah, you'll
Because
never know.
yeah, exactly. Exactly. And any anything else that you would like to add as we're in Cervical Cancer Awareness Month, or?
I would like to add that we developed a website to give information about HPV vaccination, HPV testing, and pap testing, and it also has a personalized tool in it. So you can go and enter in your own pap and HPV test results, and it will tell you what your doctor is most likely to recommend that you do in terms of follow-up.
Oh my gosh, I love that. I love that because so often people get into what we call Dr. Google,
Oh
and
God, yes. Don't do
yep,
Dr. Google.
they will get the results ahead of time, ahead of their appointment with their doctor. And then they come onto social media and say, what does this mean? Asking a bunch of people who don't have the background to do that. But with a tool like that, at least you would have a much better idea, from a much more sound basis to say, this is likely what is going on, as opposed to someone down the street going, well, to me, this is what that is, because I cannot tell you how many times that has happened. And I always tell people, go to your doctor. And I know it's hard
Yes.
to wait for results, but a tool like that would be incredibly handy to hopefully alleviate some of that stress of waiting and just simply not knowing
Yeah. And
what
so
it
the
means.
website is cervicalrisk.com.
Awesome.
And it's in English and Spanish. So please pass it along to all your friends, because it's definitely more accurate than Dr. Google.
Yes, yes, I will be happy to share that. Oh my goodness. Well, I cannot thank you enough for spending a few minutes with us. I think this is such important information to get out there, because it was like you said, some people just don't know what a cervical screening is or why they have to have one. And so, that's certainly part of our mission is, we've got a whole campaign going right now that says, screen for me. Like, if you don't know what it is, or if you haven't done it, please, please, please go get screened, because it's so
Mhm.
important
It's so
to be
important.
able to catch those things early, so that we can prevent, more serious treatment needs, or prevent cervical cancer entirely in
Absolutely.
somebody. So I do want to mention too, if you're on with us, that Cervical Cancer Summit is going to be in New York City in January 25th through the 27th. And it is open to everyone, not just survivors, not just people involved with survivor.org, but everyone. And it is an excellent place to attend in person, or we do have a virtual option where you're going to be able to learn oh my goodness, all kinds of information from health professionals. You're also going to be, which I think is cool, there's going to be some different forums. You'll be able to see an actual relationship between a patient and her doctor and sort of how they got through treatment. Oh gosh, all kinds of things that you can see. For more information on that, if you will visit the website, www.survivor.org, there is information about Summit there. And hopefully we will see some of you there in person or virtually attending with us. So again, thank you so much, Dr. Perkins, for your time. And hopefully we will see you soon.
Indeed. Thank you for having me.
Thank you. And thank you, everybody. Do let us know if you are on the replay. And any questions that you have, we will be sure to forward those on and follow up with Dr. Perkins. So thanks so much. Have a great day, everybody.
Thank you. Bye.
Bye-bye.